Dalton, can turn on your camera, please? All right, I made you a host.
The Jamaica Olympic Association is committed towards supporting our athletes and officials in the lead up to and during the Tokyo 2020 Olympic Games. This webinar will form part of our wider Tokyo 2021 campaign and will be used to both give information as well as educate our stakeholders on where we are, as well as how we intend to continue supporting our athletes in their dreams to represent the country this Summer Games. Good afternoon, I'm Dalton Myers, and welcome to another in our Road to Tokyo, Keeping the Dream Alive webinar series. On behalf of President Christopher Samuda, Secretary General Ryan Foster, and the entire board and staff of the JOA, let me welcome everyone, wherever you are streaming this webinar. And if you are on YouTube or Zoom, thanks for following us. We really appreciate it. So, today, our panelists will speak for 15 minutes each, and after the final presentation, we will take your questions. So feel free to type them in the chat, or you can raise your hand wherever you are, and we will pull those questions and pose to the panelists. We have three panelists today, Dr. Lincoln Cox, Nadia, Vassell, and Dr. Kevin Gwynne Jones. Our first presenter today on the panel will be Dr. Lincoln Cox. Dr. Cox is a general surgeon in Jamaica who has been a part of several medical teams for the country. Dr. Cox's involvement in sport is wide-ranging, and he has been spearheading medical teams to games such as the Pan American Games, Youth Olympics, as well as the Paralympic Games, and will be part of the delegation to Tokyo 2021. This afternoon, he'll be talking to us about Olympic Games and athletes' health care. Dr. Cox, welcome, and over to you.
Okay, all right, thank you very much, Dalton. I'm happy to be a part of the series, very important in preparing our athletes for the Olympics. Even more important this year, as we are now facing a pandemic. And we have to have systems in place in order to ensure the health and safety of our athletes. How can I share the screen?
All right, give us a second while the team will get that sorted out in terms of screen sharing.
Okay, I think I'm on. Are you seeing my screen now?
Yes. Yes, we are seeing the screen now.
Okay. Welcome to my presentation on the Olympic Games and athletes' health care. I hope that this talk for 15 minutes will educate our coaches or our athletes about the current situation and the preparation of the Jamaican team for the Olympic Games. Okay, we want to look at a few things here today. History of the modern Olympics very quickly, Olympic movement, medical code, the healthcare structure at the Olympic Games, and of course, we have to be mentioning COVID-19, implications of the COVID-19 pandemic on 2020 Olympic Games. I look at the protocols set out by the Tokyo 2020-21 Olympics to mitigate these challenges to healthcare at the Olympics. And of course, we're gonna just very quickly go through what Jamaica Olympic Association or National Olympic Committee is doing to help prepare the athletes for for the games. So what about the history of the Olympics? In 1948, just looking at Jamaica's venture into the Olympics, 1948, post-World War, we had 13 athletes at the Olympics. And in 2016, we had 56 athletes at the Olympics. I look at numbers because when we look at the history of the modern Olympics, in 1896, the modern Olympics took place in Athens, Greece, with only 241 athletes, all male athletes at the time. They were competing, the athletes were from 14 countries, and they were competing in 43 events and 9 sports. Look at the situation in 2016, when the numbers are ballooned up to 11,000 athletes, 11,238 to be exact, in Rio de Janeiro, from 207 countries, 306 events, and participating in 28 sports. This is a graph that's looking at the numbers to give you an idea as over the years as to how the numbers have ballooned. And very importantly, for the Tokyo 2020, 21, very important as we are now entering, we're in the middle of a pandemic and have to take care for the health of our athletes. So what about the Olympic? What about the Olympic Movement Medical Code was revised in 2016, March 31st, and it embodies the fundamental principles of Olympism. Basically, it talks about the philosophy of life exalting and combining a balanced whole the qualities of body, will, and mind. And if we look at the highlighted area, the Olympic code, the medical code embodies to minimize harm to the health of the athletes and minimize the risk of injury, illness, and psychological harm. Very important aspects of the Olympic medical code as we enter the pandemic, as we're into a pandemic. Screen was moving for a while. So looking at further at the medical code, the code allows athletes to enjoy the same fundamental rights as all patients in their relationships with their physicians and healthcare providers. That embodies human dignity, physical and psychological well-being, protection of their health and safety, self-determination, and rights to the privacy and confidentiality. The importance of the medical code reminds us that information is important to our athletes in keeping them informed. Whatever we're doing for our athletes, it needs to be mutual informed consent. Confidentiality and privacy should be encouraged, and care and treatment should be given, and the healthcare providers that we have for our athletes should be well knowledgeable about sports medicine and other aspects of medical care for the health and prevention of injury. We are committed to protection and promotion of the athlete's health during training and competition. Fitness to practice a sport is important because the entrance to the Olympics doesn't start at the time of the Olympics, but starts with training, starts with assessments of fitness. Important medical support at competition depend on the nature of the sport and the level of the competition. The level and scope of medical care must be known, and there should be adequate resources, facilities, equipment, and services. The site and sport specific, there should be a site and sport specific emergency plan, protocols and procedures for emergency evacuations for seriously ill spectator healthcare delivery, information to teams, athletes, and coaches about medical procedures and the place in competition and training setting. And very important, for information communication. What are some of our challenges we have for for Olympic Games in general? Its challenges include the uniqueness of the sport, uniqueness of the Olympic Games. It's one of the largest mass sporting events in the world. It is a penultimate competition for most athletes career. And we're looking at participation in different geographical locations. So acclimatization is important, ways of travel is important that affect athletes, food, language, and because of this large event, which is an international event, there is a stress event as well for the athlete representing their country, both for international and local expectations. What about the healthcare structure at the Olympic Games? So the medical planning and from a medical planning and organizational perspective, at the local level, the organization begins years before the actual games. It's a multi-sport event, international and mass sporting. Very important for lead time planning. At the Olympics, the host country are responsible for logistics of communication, transportation, healthcare facilities for the elite athletes. What about our National Olympic Committee, the JOA? All countries depend on the host medical plan. Their facilities, their equipments, medications, their staff, local licensure, and contacts at training facilities throughout the competition. Now, we plan based on what we know from the Olympic Village, and the facilities there will determine what we take to the Olympics, and also depending on our unique athlete, chronic or comorbid conditions that we need to facilitate. Healthcare at the Olympics begin years, is an ongoing process. Doctors, physicians, nurses, all healthcare providers that are part of the Olympic movement will know that there are annual workshops that the International Organizing Committee or the International Olympic Committee put out every year. The Advanced Team Physician course is one. I know that there are members of the team who have been to the Advanced Team Physician course and the ongoing IOC World Conference on Prevention of Injury and Illness in Sport. In 2016, we were much involved in the electronic data collection and compilation of illness and injury prevention in sport in Rio de Janeiro, Brazil. As a result of these continued healthcare seminars, the IOC have put forward a lot of consensus statements that helps healthcare providers to treat their patients. Some of these are listed here. Sudden cardiovascular death as a consensus statement in 2004, sexual harassment and abuse in sports 2007, and going down the list, sports nutrition, concussion in sport, relative energy deficiency in sport, sex reassignment and hyperandrogenism, and dietary supplementation 2017. The healthcare structure at the Olympic game involves mostly centered around these polyclinics that are located in the athlete village. Usually there's one or two, depending on the geographical spread or the site spread of the Olympics. And at these polyclinics, you can access primary care, sports medicine care, physiotherapy, chiropractic care, podiatry, ophthalmology, dentistry. These are core healthcare facilities that you can access. And for the other parts, like you see, we have orthopedic surgery, cardiology, otolaryngology, general surgery, obstetrics. All of these disciplines are on call 24 hours a day at the Olympics. The polyclinics also embodies lots of backup services, including for pharmacy, a laboratory, advanced radiological suites that has radiological investigations for such as X-rays, ultrasound, and MRI scanners. The aim of the polyclinics, based on the diverse nature of the sport, is to make a quick diagnosis and to allow for competent treatment and safe return to competition as soon and as safe as possible. The polyclinics are staffed by doctors, nurses, physiotherapists, masseuse technicians, administrative staff, and they're open 24 hours for 24-hour service, as we said before, and they tend to open 2 weeks before the start of the Olympics, varying times, but about 2 weeks before the start of the Olympics, and they close after the closing ceremony. I had mentioned this before. Jamaica was a part of the first electronic medical records at the 2016 Olympics, and they were part of the injury and illness data collection. We were a part of that study. We can't talk about Tokyo 2020 without talking about the coronavirus disease and Tokyo 2020. Now, Tokyo 2020 is not the first Olympic to experience a pandemic, because the 1920 Olympics in Belgium, they were just post the pandemic of the Spanish flu, and they prevailed in 1920, and I think we can prevail in 2020. So what is COVID-19 disease? It's caused by a virus, the severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, outbreak in Wuhan, China in 2019. It is thought to be a zoonosis by WHO just recently on their investigations in Wuhan. It was thought of as a public health emergency of international concern in January last year, and then declared a pandemic by the WHO in March 11, 2020, resulting in the postponement of the Tokyo 2020 Olympics. And it's now postponed until 2021. The virus enters the human cells by binding to angiotensin converting enzyme 2. And since this is not a lecture on SARS-CoV-2 or COVID-19 disease, we're just going to move swiftly through these slides. How is it transmitted? Respiratory droplets, aerosols, or droplet nuclei from the respiratory system, transmitted through coughing, sneezing, talking, singing, or breathing. Can be contracted from surfaces as well. Airborne transmission is possible in high-risk environments. Aerosol generating medical procedures are high-risk procedures, can be contacted through toilets. Direct contact, kissing is highly infectious. And it's an incubation period of about 3 to 6 days, but a patient can transmit before they develop symptoms. So there's asymptomatic people who transmit the disease. What are the symptoms of COVID-19? The most common symptoms are fever, a dry cough, and tiredness. Less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis. Of course, this is not an exhaustive list, but some of the most serious symptoms we see for the COVID-19 disease is difficulty breathing or shortness of breath, chest pain or pressures, and loss of speech or movement. How do we treat it? Again, it's not a lecture about treatment, but prevention is the important thing. And we're going to be hearing it about as we get into preparing for Tokyo, mass social distances, persistent hygiene, avoid the 3 C's, and you contact a facility. But as we go on, we'll explain more of this. What's the IOC statements on the 2020 games? Health and safety, the most important thing. And this year will be a test of the COVID-19 protocols in Tokyo, and how well those stood up to the test of this Olympics. 2020 Tokyo, because of the pandemic, has published a series of what they call playbooks. As these playbooks are updated monthly, and we're expecting an update on these playbooks in April 2021, it is just tomorrow. And they tend to update you on the important aspects of your road to Tokyo, which is going to be a long one, as it's going to be involving a whole lot of COVID-19 testing and procedures that has to be adhered to. What are the playbook principles then? Minimize physical interactions. We talk about the 3 C's, closed spaces, crowded or involved areas. We test, trace, and isolate is a key, and think hygiene all the time. The road to Tokyo is going to begin, or has begun, we should say. However, when you look at the playbook, you are going to be very much connected to the Tokyo 2020 organizing committee 14 days prior to departure to Tokyo. You have to, 14 days before the departure, you have to monitor your symptoms. You have to, any symptoms of COVID-19 should be reported, as we mentioned before, those symptoms of fever, whether it be malaise or fatigue, shortness of breath, etc. Each National Olympic Committee, like JOA, has to elect a COVID-19 liaison officer. Before you enter Tokyo, you will need a pre-valid card or a visa. We know that. 14-day activity plan on entering Tokyo. So you have to lay out to the Tokyo Organizing Committee what exactly each person is going to be doing on entering Tokyo for those days. COVID-19 travel requirements are necessary by the airlines, and we have to adhere to those. You have to download and install and register contact confirming app with the CCCOA on your phones. And it's a requirement that there has to be a COVID-19 test done, test approved by the government of Japan 72 hours before departure. You have to be negative to enter Japan. When you arrive in Japan, prepare to take another COVID-19 test. And you have to be there with your visa, your regular travel documents, and a negative COVID-19 certificate. And you have to be ready to be tested again. Now, the details as to how often you test depend on who you are and what your participation level is going to be at the Olympics. Those details as to the possible number of tests you'll have to do will be detailed in the playbooks coming soon. I know that for World Relays, for example, that's coming up at the end of April, they mandate that there is, apart from testing before, on arriving in Poland, you are going to be tested, whatever time you're going to be in Poland, you have to be tested every 48 hours, no matter who you are. For athletes, on a webinar we had with the Japanese Olympic Association, there were many different protocols related to different members of the team, and athletes, I think, will be tested much more regularly than anybody else. When you arrive in Japan, there's no stopping anywhere, and you can only use designated transport, and you have to disinfect regularly. At the games, test, trace, and isolate is always going to be reinforced regularly. Now, regular COVID-19, the tests, as I said, depending on what role you are playing at the Olympics. And those, what regularity means will become more clear as we enter April with the new playbooks. At the games, you have to keep a close contact list up to date of everybody that you have been around. Your movement is going to be restricted because of this. You have to minimize contact with athletes, 2 meters, keep 1 meter from any other persons, and you have to avoid crowds and closed spaces there. When you leave in Tokyo, again, you have to take another COVID-19 test and other tests depending on the country that you're coming from. In Jamaica, I think we're going to require that there's a test, and it's going to require that we're isolated post arriving back in Jamaica. What is the IOC position on vaccination? Right now, you will not be required to have received the COVID-19 vaccine to participate. However, the IOC continues to support the vaccination of priority groups. And as the vaccine become more available, the IOC encourage all Olympic and Paralympic team members to be vaccinated. There are going to be a lot of sanctions associated with non-compliance with the COVID-19 protocols. One of them is going to be prevention from entering venues, and there's a possibility that for persons who may breach the rules of the protocol for revocation of their accreditation. The Jamaica Olympic Association continues to prepare for the Tokyo 2020 Games, and the road to Tokyo, keeping the dream alive, is one way in which we continue to sensitize ourselves and sensitize athletes and members of the team going to Tokyo. We'll have to appoint a COVID-19 liaison officer. The medical team assembly will be made known. IOC seminars are important adjuncts to preparing for Tokyo. As the IOC continue to update the playbook for Tokyo 2020, we'll be updating our members as we go on. Medication equipment register is an important part of preparing for the Olympics. And one of the things that we've not been, what we have to look at is an athlete's pool registry, and look at the build up, the athlete preparation for the Olympics as they prepare and aspire to go to the 2020 Olympics. Thank you very much.
Thank you very much, Dr. Cox. Really appreciate the feedback so far, and very good presentation. If you're just joining us, welcome. And we have 3 presenters for today on our panelists, and we're going to be getting to each of them. But just to remind you that our social media pages, on Instagram, we are Jamaica Olympic, on Twitter, JA Olympic, and on Facebook, Jamaica Olympic. YouTube is the Jamaica Olympic Association. That is our YouTube channel. Feel free. We want you to like and subscribe, or certainly subscribe, click notification bell, and all those lovely things that are there. Thanks again, Dr. Cox. Our second presenter will be Miss Nadia Vassell. Now, Miss Vassell is the Director of Technical Services at the Jamaica Anti-Doping Commission, and she has been spearheading the educational aspect of that, certainly through anti-doping workshops for both junior and senior athletes. She's widely recognized for her knowledge on both the articles and the application of the WADA code as it regards to anti-doping. This evening, she'll be talking to us about the preparation, doping control, and the WADA code. Again, Miss Nadia Vassell. Nadia, welcome, and over to you.
All right, thank you very much. I want to start to share my screen with you. It is saying that you have disabled screen sharing.
All right, the technical team, I'm sure, is going to get that sorted out. Tetleroy Henry over there and Rashika Grant.
All right, it's coming up now.
Appreciate it. While Nadia get that sorted out, welcome to everyone, whichever channel that you are in. I see some people in YouTube. Please feel free to leave some questions there, or in Zoom. We'll be having a question and answer segment for the presenters. Nadia, over to you.
All right, thanks again. So Thank you, everyone. And so what I'll be talking about is just the what is expected of the athletes at the Tokyo 2021 Olympics in terms of doping control. All right. So, of course, as Dr. Cox has mentioned, we are in the period of the COVID-19 pandemic. And of course, athletes and athlete support personnel, they must adhere to any restrictions, guidelines, and rules imposed by the IOC, the International Olympic Committee, during the pandemic. Now, for doping control, the IOC has delegated the International Testing Authority, ITA, to conduct certain aspects of doping control during the Olympics. So they're working, the IOC, of course, is the major event organizer, and they are working with the ITA for doping control. I want to advise the audience that there is an IOC anti-doping rule. This actually came out in June 2019 for the Tokyo 2020 Olympics. And so all, or if not most, of the information that I am presenting today is coming from the anti-doping rules for the IOC for the Tokyo 2020. I have not seen an update as yet, but in my presentation, what I did was incorporate the 2021 code, the different aspects of the 2021 code in this presentation. All right. So from what I researched, I can see that the Olympic dates are starting from July 23rd to August 8th. All Olympic athletes will be under the IOC testing rules from the day the Olympic Village opens to the closing of the ceremony. Of course, athletes, you can be tested anytime, anywhere during the period of the games, whether it is in competition or whether it is out of competition. All right. Now, as I said, I have used the 2021, the new code, which came out to prepare this presentation as a 2021. The anti-doping rules that the IOC produced was from the 2020 code. But what I did, I just fixed it together because I know that the 2021 code is now in force. So for in competition, it's a period commencing at 11:59 p.m. on the day before the competition, in which the athlete is scheduled to participate through to the end of the competition and the sample collection session related to that particular competition. Now, out of competition refers to any other period during the athlete's participation in the game. So you can be training in your village, in your rooms. You can be tested out of competition anytime, anywhere. Now, as athletes, you have to be aware of your rights and responsibilities, okay, during doping control. So your rights, or during the testing process, your rights to be accompanied by a representative and or interpreter during the sample collection process. If you need more information about the sample collection process, you can always ask. You have the right to request modifications to the sample collection process. For example, if you have an impairment or if you are a minor, you also have the right to request a delay in reporting to the doping control station, but this is for valid reasons only. And what are valid reasons? So say for instance, if you're in competition and the doping control officer comes to notify you, and before you go to the doping control station, wherever that may be, and say for instance, there's a delay to report to the doping control station, then these are some of the valid reasons for the delay in reporting to the doping control station, meaning doping control station is the area where you're going to be tested. So say for instance, if you're participating in a victory ceremony, the chaperone or whoever notified you more likely it would be a chaperone, will allow you to participate in that victory ceremony. If it's if you need to speak to the media, if you have to warm down or cool down, if you have to compete in further competitions, if you have to obtain necessary medical treatment, if you have to obtain your photo ID, or if you have to locate a representative and or interpreter, and also any other exceptional circumstances which may be justified and as approved by the doping control officer. So that's the doping control officer, the person who is in charge of the session. Out of competition, so you're for valid reasons for the delay, if you need to, some of the same reasons as in competition, and you can see there on the screen, those practically some of the same reasons. Okay, now as athletes, you also have responsibilities. So with rights, you also have responsibilities. So you're responsible to comply with the sample collection process. You are responsible to provide appropriate identification, to report immediately to the doping control station immediately, unless there are valid reasons for that delay. And you also have the responsibility to remain within continuous observation of the DC or chaperone at all times from the point you are notified until the sample collection procedure is complete. So whether they're taking urine or they're taking blood sample, until the sample collection procedure is complete. Now, as athletes going to the Tokyo 2021 Olympics, we want to ensure that you have a copy of the 2021 prohibited list. Okay, so if you do not know what the 2021 prohibited list is, it's a list of, well, it's a list of banned substances and methods. So if an athlete gets a, say, positive test, what this means is that a substance on the prohibited list was actually found in your sample. So you want to ensure that you have a copy of the 2021 prohibited list. That is, you can find that on the WADA website or the JADCO website. And as athletes, we want you to remember the strict liability principle. You are responsible for whatever substance is found in your sample, whether you intentionally or unintentionally took that substance. You are responsible. You're the one who is going to end up in front of the disciplinary panel to answer to any charges. All right, so as athletes going to the Tokyo 2021 Olympics, for athletes in our registered testing pool, JADCO registered testing pool, or lower testing pool, the registered testing pool is a pool of our top level athletes. The lower testing pool is a pool of our upcoming athletes, right? And they file whereabouts with us. They will be required to continue filing their whereabouts information in Adams. Now, upon request from the IOC, athletes must provide other, so like say for instance, if those are like national athletes who are not in the RTP or the LTP, they must also provide whereabouts information. And usually that whereabouts information will be provided to the NOC, the National Anti-Doping Committee, when they get on the ground in Tokyo. So they will ensure that they get the whereabouts of those other athletes. Athletes must respect any time limit imposed by the IOC ITA for the provision of their whereabouts information. Now, if you're applying for a TUE, of course, athlete, is your responsibility to find out if you need one. Now, if an athlete is taking a medication on the 2021 prohibited list, right, they need to apply for an authorization to use that prohibited substance and or method during the game. Now, where an athlete already has a TUE granted by the athlete's national anti-doping organization, so say for instance, if you have a TUE already granted by JADCO, or if you are in an international federation and a TUE is already granted by that international federation, and provided that such TUE is not, and I must stress, is not available on Adams, because most times when you do an application for a TUE, everything is in Adams, right? So if that application, if that TUE certificate is not in Adams, then the athlete must submit such TUE to the IOC, ITA, the Therapeutic Use Exemption Committee for recognition at least 30 days before the start of the game. If the athlete is not already in possession of a TUE and you need a TUE and you're going to the games, right? You will need to make an application to the IOC, ITA, Therapeutic Use Exemption Committee at least 30 days before the commencement of the games. TUEs granted by the IOC will only be valid during the period of the 2021 Tokyo Olympic Games. So it won't be valid afterwards, okay? So yes, it would not be valid afterwards, after the games. All right, so athletes who commit an anti-doping rule violation will have the right to a hearing convened by the IOC disciplinary panel. And in this case, it is called the CAS Anti-Doping Division. Okay, now violations during or after the games can be sanctioned with any or all of the following. Athletes, sanctions you can get disqualification of results, forfeiture of medals, points, and other prizes, disqualification from further competing in the games, and a period of ineligibility from the sport. Now, of course, all decisions are subject to appeal, which can be made to the appeal arm of CAS. All right, and I just want to remind you of the anti-doping rules, which there are with the new code, 11 of them. So you have the presence of the prohibited or banned substance, its metabolites or markers in a sample. So if an athlete is tested and there's an adverse analytical finding, meaning that the athlete tests positive, right? That constitutes an anti-doping rule violation. The athlete will end up in front of, they will have a right to a hearing in front of the CAS Anti-Doping Division. If an athlete use or attempt to use banned substances or banned methods and they are caught, they will have the right to a hearing in front of the CAS Anti-Doping Division. If an athlete evade, refuse, or fail to submit to sample collection, they will have the right to a hearing in front of the CAS Anti-Doping Division. If an athlete tamper or attempt to tamper with the doping control process, okay, and they are charged with that, they will have the right to a hearing in front of the CAS Anti-Doping Division. If the athlete is found in possession of the banned substances or methods, or even if the athlete support personnel is found in possession of banned substances or banned methods without the requisite TUE, right, then they can also get a sanction. Trafficking, the athlete is caught trafficking. If the athlete is caught administering any banned substances to themselves or even to another athlete, okay, and they're caught, they can end up in front of the CAS Anti-Doping Division, right, for the hearing. Now the whereabouts also is still in place, okay, and these are for athletes in the registered testing pool. All right, so what my research show is that the athletes still can get the whereabouts violation. So 3 filing failures and/or missed tests in the 12-month period. So say for instance, an athlete goes to Tokyo, that athlete is in the registered testing pool, right? So as athletes in the registered testing pool are able to get whereabouts violation. So say for instance, the athlete puts that they're going to be in room 20 on this block, and the DCO comes to test that athlete and the athlete is not there. right? They can still get a missed test, right? But what I saw is that the anti-doping organization who has the custody of that athlete, right? They will be the ones that will do the result management of that whereabouts violation, that whereabouts failure. So if it's a missed test or if it's a filing failure, right? So say for instance, it was an athlete in JADCA's registered testing pool, we will still be the ones that will do the result management on that whereabouts failure. Now, complicity or attempted complicity. So if an athlete assists, encourage, aid, abet, conspire, or even cover up an anti-doping rule violation, right? They can end up in front of the CAS Anti-Doping Division to answer to the charge. Prohibited association. Okay, so if an athlete, just an example, is having a professional relationship with, for instance, a coach or even a medical doctor who is banned or who is serving a period of ineligibility from the sport, right? Then they can also be charged with prohibited association, okay? And number 11, this one was actually added to the 2021 code, acts by an athlete or other person to discourage or retaliate against reporting to authorities. So this is actually for the whistleblowers. So say for instance, an athlete is caught doping, and the person who catches that athlete doping is going to report that athlete. And say, for instance, the athlete who is doping decides to retaliate against that athlete who wants to report him, or that athlete is trying to discourage that other athlete from reporting him, then that athlete who was actually doping can also be charged under the anti-doping rules. Okay, and of course, as I said before, for the 11 anti-doping rules, the sanctions, it will be up to the CAS Anti-Doping Division to hand down the sanction, and I referred to some of the sanctions before. All right, and that's the end of my presentation.
Thank you very much, Nadia. Really appreciate it.
Okay.
We're going to be taking questions after the final presenter. There's quite a number of questions that are coming in so far, and we just want to thank everyone for joining us. We see your questions certainly on YouTube channel and also in Zoom, and we're going to be taking some of those questions after Dr. Jones. And feel free to put more. I'm sure they're able to answer those questions. Dr. Kevin Gwynn Jones is next. Dr. Jones is a consultant orthopedic surgeon and also the president of the Jamaica Sport Medicine Association, doing a really good job there, Dr. Jones. He has been involved with sport for decades. Dr. Jones, I almost put centuries there, but I'm just going to just be nice and say for decades. Really been working for a long while and continue to provide assistance to students and to athletes, both at the junior and senior levels. He has been instrumental in several Jamaican teams to major games, including Olympics and just other games that are regional and international games. And today, he's going to be talking to us about preparing for Tokyo 2021 and returning to safe training in Jamaica. Dr. Jones, if you are there, over to you.
Afternoon, Dalton. Thanks very much for inviting me to present at this webinar. I'm trying to share because I couldn't get on via Zoom, so I'm trying to share via the browser.
Are you able to share? I'm sure the technical team will give you permission.
Yeah, well, I'm trying to share using the, well, I'm trying to get to the presentation, but it's, but I'm not able to see it. Because normally I would try and do this through the Zoom platform, and I'd be able to share directly from there, but I'd have to join through the browser. So,
Right. Well, while that gets sorted out, Dr. Jones, just take your time and sort it out. Dr. Cox, prepared. We have some questions soon that will be taken to you if you're just joining us. Welcome to our webinar series. It is the second webinar, second of 3 that is looking at Tokyo 2021, but we have quite a number of other activities to share with you throughout the year. The first one was good. This is the second one. And so far, we have had 2 presentations, one by Dr. Lincoln Cox and also by Miss Nadia Vassell. And so those 2 presentations have gone. Remember also, we are on Instagram, Jamaica Olympic. On Twitter, we are JA Olympic. And on Facebook, Jamaica Olympic. And certainly on YouTube, Jamaica Olympic Association. And on YouTube, we want you to subscribe to the channel. There are a lot of content that we're going to be putting up there for your viewing. So just getting ready. Dr. Jones had some technical difficulties. Well, certainly because part of it, we had kicked him off, but he's getting that sorted out. I can see my friend Paul Reed. I see your question. Simon Preston. Dr. Jason Scott Hamilton, welcome. And Sean Lee, worked with Sean at the Commonwealth Games 2018, as well as Dr. Joe Brown is also there. Welcome to everyone. We're seeing all the comments also in Zoom and the private messages that I'm getting. Just waiting to start here.
All right, this is I must see my face come up application window.
Dr. Jones, is it something you can shoot in an email to us and we can put up and just get some of the questions in the meantime, or that won't happen?
I'm sure I'll think that I'll send it to Ted, right? See what happens.
Or if you had sent it to him?
No, I did that just now.
All right. Team, while we get that set up for Dr. Jones, Rashika Tetleroy, we're just going to ask to help with that one. And we will just switch to 1 and 2 of the questions that are there. I probably want to pose a question, Rashika, to Nadia. The first question is going to go to Nadia while we set up for Dr. Jones. Nadia, welcome again. The first question I'm going to pose to you, someone asked me, as it regards to the whereabout, probably not that tricky, but if someone has 2 whereabout violation from JADCO, and then they go to the games and there is a 3rd issue at the games, how quickly, they're asking, I think, will that be sorted out, and will it be their challenge if the JOA does not provide the requisite information to the IOC?
All right, so certainly if one happens at the game, then it will be 3 whereabouts violation within, well, once it's within a 12-month period. Now, I am not sure how quickly the IOC would report that to us. I've never really had that situation before, so I couldn't really comment on that, but I can tell you it will be 3 whereabouts violation. It would be 3 whereabouts failure, which will be a whereabouts violation, and of course the result management process will begin. But I can't tell you how quickly JADCO will receive that information. I'm not sure.
All right, thank you very much. Dr. Cox, okay, so we seem to have things settled. Dr. Cox, I was coming to you, but Dr. Jones is ready to go. So I'll turn over now to Dr. Kevin Gwynn Jones. You probably want to unmute for us, Dr. Jones. Sorry, Dr. Jones, I can see him. There we go.
Yeah, thanks for asking me to present at this webinar, which is vital for our preparation going forward for the Olympics. I have nothing to declare. Next. All right, so just a brief introduction. Remember that we're talking about the novel coronavirus, and the novel means that it is new, so a lot of information is still not known. So what I'm going to share with you is what we do know about the virus and how it is transmitted and how we can go about trying to prevent that from being transmitted as we proceed in going forward with training. I'm trying, for the presentation, I'm trying not to say do this or do that, or don't do this or don't do that, but to lay down the basic principles of how the virus is transmitted, and for each individual to apply the basic principles to prevent it while they're training. Next. All right, so the objectives here are therefore to identify the routes of spread of the virus, devising ways to prevent the virus transmission, and this is in all sports, implementing protocols into daily training routines to prevent the virus contraction and its transmission to other individuals. And then if by chance you do get the virus, I'd like to look at how we return to training after. All right, so modes of spread, a lot of this you know already, so a lot of this will be reminders. So remember, it's spread by aerosol droplets or by direct contact with contaminated surfaces. And usually how you get the direct contact with contaminated surfaces by your hands touching these surfaces and then touching a part of the body where you have the receptors that will allow the virus to be transmitted. And those parts of the body particularly include the respiratory tract, the oral cavity, the eyes, and the genitals. All right, now, because the whole part of training is to try and first not to get infected, you want to try and prevent, getting infected. So this means avoid the people who have been in contact. Now remember that individuals are incubate the virus about 2 to 14 days before this may show signs of symptoms. So if somebody you know has been in contact with somebody who has the virus, then you should avoid them for that 2 to 14 day period to reduce the risk of contaminated and contracting the disease. And the median time for it to present is about 4 to 5 days. And usually most people stop being infectious after 10 to 14 days, or what they describe as 24 hours after they have no symptoms, i.e. no fever, no muscle aches, no cough, no sneezing or anything like that. Next. All right, so what are the symptoms? And you should be able to recognize the symptoms so that you can avoid such persons who could potentially be infected. So a lot of them you know already, fever or chills, and chills, that sensation that you get just before a fever comes on. A cough, and it's not somebody choking on food and coughing. A lot of times people eating and they choke and they cough and people run away from them, and it's not necessary there. Shortness of breath, or difficulty breathing. Fatigue is general sense of fatigue when you don't have any other reason for being fatigued, i.e. you haven't been up late all night studying or watching TV or whatever. Muscle aches and pains. A lot of persons got this after they got the vaccine. Headache, something that is quite common, and I mean, does it mean you avoid everybody who gets a headache? Just be wary. And new loss of taste or smell. So that's something that has happened before, but if you're experiencing a new loss of taste or smell, then you would be a possibility of you having the virus. Sore throat, nasal congestion or runny nose, nausea or vomiting and diarrhea. People forget that it can cause some gastrointestinal symptoms, and that's important to remember to avoid such individuals. Now, how are you going to prevent this from happening? Therefore, you want to prevent the contact of any contaminated surface with, like the mucous membranes where the virus can be transmitted. So majorly through the respiratory tract. So the wearing of a mask. When you can, you wear a mask. So that will prevent you inhaling any infected droplets that might come in contact with your mucous membranes in your nasal passage and therefore be transmitted to you. Remember, your eyes are a very open area for virus transmission. So you either wear goggles to protect your eyes or a face shield face shield, and then you'd have to, depending on your sport, I mean, a pair of goggles might be most effective in some, if by chance you're going to be in close contact with somebody who might be breathing or passing droplets into your close personal space. Remember, your hands, it doesn't get transmitted through your skin, but your hands are one of the main means of transmitting the virus to the potential affected sites in your body. So even though your hands might have the virus on them, provided you don't touch those areas that I spoke about earlier, you will not transmit the virus to yourself. So to reduce that risk, you will want to make sure that you sanitize your hands, and two, avoid your hands becoming in contact with sites that you can potentially transmit the virus. Next. All right, so let's going to run through a bunch of surfaces in which the virus can be transmitted. So as you go about your day-to-day activities, you should be able to look and see where you would want to the potential that you could pick up the virus and then potentially transmit it to yourself. So metal, they talk about it being exposed on metal. That includes silverware that you eat, that's for about 5 days. For wood, on doors, tables, etc., and for other furniture, 4 days. Next. Plastic, stainless steels, cardboard, copper, and other metals like copper. You talk about 2 to 3 days for plastics and stainless steel, and for cardboard, like 24 hours, and for copper, 4 hours. Aluminium is about 2 to 8 hours. Glass is like drinking glasses that you might have at a bar, at a restaurant, or whatever, can stay on there for up to 5 days. Just hope that the people in the restaurant and people at the house that you go to are adequately washing these devices. Paper, like newspaper and so forth, they say it can stay viable on these services for about 5 days. Next. Food, there's no indication that the viruses can be transmitted by food, so you can eat food safely without worrying about it being transmitted. In terms of water, the national water supply is pretty good, pretty consistently treated throughout the country, and there's no indication that the virus is being transmitted by that means. Fabrics such as clothes and linen, not much research has been done, but they probably the virus won't stay on your clothes as long as it does on like a hard surface, because on fabrics and so forth, it can lead to its absorption of moisture, and therefore can lead to desiccation of the virus. So you little risk of transmission from such surfaces. Shoes, a study out of a Chinese ICU shows that although they found they found virus particles on the soles of shoes, there was no clear indication that they could cause infection. So this need to be taken off your shoes before you go to your house and spray the bottom of your shoes and so forth. There's questions about whether that is really necessary. Skin and hair, a lot of girls wearing weaves and so forth and things. There's no research yet on that, whether the virus is being transmitted by that. We do know that one of the common coronaviruses that is responsible for seasonal runny nose and bronchitis and so forth can survive for hours in hair and on your skin. So as a result, it's important that you disinfect your hands on a regular basis. Next. All right, so provincial protocols. So you want to first of all avoid contact with infected persons, and if you cannot do that, you want to limit your contact with them, and that involves social distancing, wearing your mask so you don't inhale particles, and as far as that is concerned, if somebody actually has the virus, them wearing the mask is actually a safer means of preventing the virus being transmitted than you having the mask on. So if the person has the virus and they have the mask on, it highly reduces the risk of them transmitting it, as opposed to you having the mask on and the person who is infected not having a mask on. The risk of you contracting the virus is actually higher in such situations. Hand sanitize can overemphasize this point. Once you come in contact with a potential surface, spray your hands. Wear goggles over your eyes or a face shield, whatever is appropriate. And then gloves are not really necessary unless you have open wounds. As if you have a wound on your hand, such as a bruise or so forth, gloves. So the virus is, it binds to these receptors, which are on next. Let's run through these, which is on the surface that we mentioned. And then when it does that, it enters the cell and it multiplies, and then it goes out into the bloodstream. And then from there, it can get transmitted to other persons and to other parts of the body. Next. All right, now the systems that are commonly affected are your respiratory system, your cardiovascular system, which includes your heart and your blood vessels, your kidneys, your gastrointestinal tract, and your nervous system. Next. Now, in the respiratory system, we're divided to upper and lower respiratory tract, and each aspect can be affected. If it's the upper respiratory tract, you tend to just get coughs, sniffles, runny nose, etc. If it's the lower respiratory tract, you can end up with a pneumonia or whatever. Next. Okay, so if it's in the upper respiratory tract, you can have those symptoms as we prescribed. Oh. Continue. Next. In terms of the heart, if the virus affects your heart, it cause an inflammation of the heart muscle, which can cause impair the heart's ability to pump blood around the body. If it's really severe case, it can lead to an abnormal heart rhythm and possibly a heart attack. In terms of the blood vessels, it can cause the blood vessels to leak, so it can cause it to have swelling, and it can cause it to possibly have a stroke. And in some cases, if it's really bad, it can cause it to lose a limb. Next. In terms of the nervous system, it's linked. The virus has been linked, as you know, first loss of smell and taste, and there are some psychological conditions that it can cause. It's been associated with, such as psychosis, post-traumatic stress disorder, stress, depression, and possibly nerve damage. And there are cases of it being associated with some forms of dementia. Next. In terms of the renal system, this can cause renal failure, but this is usually in persons who have really bad infections. Next. The gastrointestinal tract, it can affect your liver, but so far it hasn't really led to any significant liver damage to cause you to have any impaired liver functions. Next. And however, if you do have an impaired liver as a result of either cirrhosis from alcohol abuse or from a viral infection, then it could further compromise the liver function and cause you to have problems. Next. And then other general gastrointestinal, so nausea, vomiting, and diarrhea, and it can affect your pancreas, which is one of the main digestive organs. Next. All right, so I told you all of that, so try and hope that you could just understand the basic things behind it, so that if I don't mention something specifically, you should be able to look and see how you can prevent the virus from being transmitted by just looking at all the means at which it can be passed from one individual to another. Now, as sportsmen, the Jamaican Association of Sportsmen, we had gone through all the different sports and looked at the possible ways that the virus could be transmitted, and then tried to make recommendations as to how best to prevent viral transmission during these sports. Next slide. All right, so in general, it is trying to obey protocols in terms of, you know, all of these already. Restrict your contact with people, whether infected or not. Everybody's potentially infected. So if you can train and participate without being in contact with an individual, then you go ahead and do as such. So if you're involved in a racket sport, you can play and you can train and you can do all the necessary things that you need to do. However, don't congratulate each other by touching hands. You can touch elbows and so forth and things, but you can social distance while you play those sports, so you can train accordingly. In situations where you might have to come in contact with somebody face to face, wear a mask to prevent the droplet transmission. In situations where you can't do that, in like contact sports, then there's going to be a need to have extensive testing so that individuals that are coming in contact and face-to-face are COVID negative when they are engaging in such activities. Otherwise, it's not really safe to engage in such activities. Reduce hand contact with infected surfaces. So if you can, where necessary, don't touch anything that you don't need to touch. Keep your hands to your own self and your own equipment, and that will help to reduce the means of transmission. And if by chance your hands do come in contact with a potential contaminated surface, avoid rubbing your eyes, picking your nose, sticking your finger in your mouth, or touching any other sensitive areas where the virus could be transmitted from your hands through these areas. And then if by chance you have your hands are contaminated, always remember to sanitize. Always walk with your own personal sanitization. In terms of training drills where possible, practice isolated drills and training where possible. Like in football, you can practice dribbling drills, juggling, you can practice free kicks, stuff like that. Anything that you can do in this by yourself. This is basketball, you practice your dribbling, you practice shooting, and other dexterity drills like that. That provided you don't have to come in contact with anything. For other sports, it is very easy to do. For like cycling, you can ride your bicycle and do your drills by socially distance from anybody without having to worry about it. For the equine sports, there's no incidents of horses being one infected with the virus or two transmitted to individuals. So those are quite safe once it's just you on the horse and doing whatever you have to do. You can do those freely without having to worry about contacting the virus or giving it to the horse if by chance you have it. Next. Now, some general principles like weightlifting. Now, weightlifting is a basic part of most sports in terms of strength training, and most sports have some form of strength training. What you want to avoid is a situation like this. When you're spotting somebody who is benching, do not spot directly over them like this. So you'd have to spot from the side, which would involve two persons at the end of the bar. And while you're doing this, we recommend that you wear a mask. If by chance you have to spot overhead, both you and the individual on the table should wear a mask, because for those of you who have bench press, like I said, a lot of times when you exhale, especially when you're under pressure, droplets go flying up. I've seen them personally while I attempt to lift that time. So wearing a mask will prevent, but otherwise spot from the sides. For equipment that is shared, use a towel on it. All right, so use towels on it. I mean, I've been to gyms and I've seen individuals using the same bits of equipment and they're not using a towel and they're not cleaning the equipment in between. So people using a bench and they're just using it without a towel and nobody wipes it down in between. If you're the only person using that piece of equipment, then you can use it without sanitizing in between. So if you're the only person using the bar and you're the only person using the bench, then once you're the only person in that space, that is your bubble, you do not have to wipe it down in between. The only time it becomes necessary to wipe something down is if somebody else is going to come in and invade that personal space and break your cycle and potentially contaminate. But if you're the only person on the machine, then once you sanitize it before, you do not have to re-sanitize it until the end of that workout. Next. All right, so for in between users, wipe down the equipment, make sure it is sanitized. So like I said, but if you're the only person there, then just go, feel free to continue. Next. Where possible, do not share equipment. All right, and this goes for the throwers, for racket sports, do not share your racket with anybody. Well, for like certain racket sports, well, you might have to share, you will come in contact your hands like with a shuttle or with a ball if it's tennis or if it's a volleyball or whatever. In such cases, just remember to keep your hands out of your eyes, your nose, and other places like that. If you must share something, make sure you sanitize, try to sanitize it in between. We recommend 70% isopropyl or ethyl alcohol because these don't leave residues and disappear, so it won't interfere with you throwing or anything like that. And then always sanitize your hands. Now, like as far as for swimming, so far to date, the CDC is not aware of any scientific reports of the virus being spread in large bodies of water. And this includes pools, hot tubs, and water parks. and on aquatic venues. Where you might pick up the virus when you're exiting the pool, like here, you're holding on to the railing and so forth, and then when you're on the sideline chatting to each other and just sitting down and fellowshipping. So in such situations, once you come out to the pool, you use the railing, sanitize, wipe your hands down with some alcohol or whatever, and then when you're outside with the rest of your teammates, other people training, put your mask on and social distance. Next. Now, if you have contracted the virus, so that is basically how you want to do with in terms of training and preventing yourself from catching the virus. However, if by chance you have contracted the virus, you need to be aware of what that you need to do before you return to play. Now, this will depend on the course of your disease and the extent of your symptoms. So the course of the disease will whether if you had mild symptoms where you just isolated at home and you didn't have to receive any major treatment apart from symptomatic medication, or if you've had moderate or severe symptoms required hospitalization. Next. Thank you. Go. All right. If by chance you've had a major involvement with your heart or whatever, you need to get your heart properly evaluated with a variety of tests to make sure that you're fit to go back to training. Next. If by chance that affects your lungs and you have significant lung damage, you need to do the lung function test and have that evaluated before you go back to training. If you had significant kidney involvement, once your kidney function returns to normal, you will be able to go back to training. I say liver function test. Like I said, the liver is not likely to have any significant damage. And likewise, your pancreas did not have supposed to have any, no document in the case of any prolonged damage to these organs. Next. If there are any psychological issues, post-traumatic stress disorder, whatever, get psychiatric involvement, and sometimes it might affect your ability to sleep. You might want to prescribe a mild sedatives, and most of those are not on the ban list. Next. And for most sports. Now, if by chance you end up in a hospital, you end up getting treated with with banned substances such as glucocorticosteroids, make sure that you have copies of your medical records and so forth, and notes from your doctors, and you apply for a therapeutic use exemption. Now, whatever it is, you should be treated, and that would be done after you have recovered. It's not something that you need to do before you get treated. The whole purpose is to save your life, and then after that, you can sort through getting a therapeutic exemption after the fact. Next. Remember that oral decongestants that you might use for those running nose and so forth, most of them are banned in competition. So outside of competition, they're safe to take. Just make sure that you document it if and when you get tested. Next. I said it before, so you obtain your medical records and apply to JADCO for therapeutic exemption. Ms. Vassell had touched on some of this earlier. Next. When you return to sport from a severe list, the main thing is to gradually return. You're not going to go back in and start to train hard. All of a sudden, you do it in a stepwise fashion with minimal exertion first, and then over intervals of like 4 to 6 weeks, you gradually increase the intensity until you're able to get back to full training. And we can end there. Thank you very much.
Thank you very much, Dr. Jones. Some really good information there. And so we are going to go to some of the questions quickly. So ladies and gentlemen, if you're just joining us, 3 great presenters so far. We're going to be taking some of the questions. Again, I'm your moderator, Dalton Myers, and Dr. Cox. I'm going to put one of the questions to you first, if you don't mind. Question here from Simon Preston. And so Dr. Cox, yeah, Simon Preston says, would you advise Jamaican athletes and the entire delegation to take the vaccine prior to departure to Tokyo Games? And the second question, do you believe our athletes should avoid training in groups and pairs to maintain physical distancing and reduce risk of catching virus at the games. And just before Dr. Cox comes on, I just wanted to say this, that the GOA so far does not have a policy on mass vaccination of athletes, but that's something at some point that the GOA will make a position fully on. All right, so Dr. Cox.
Yes, sorry. The International Olympic Committee does lay that out in their playbook in terms of vaccinations, and being vaccinated is not a requirement to participate in the 2020 Tokyo Olympics. However, the IOC went on to support the vaccination strategies of the CDC and other organizations within countries, promoting vaccination of high-risk healthcare workers and other individuals in the medical team. They do also recommend that as vaccinations become more available, because the problem now with vaccinations, they're not available to everybody. And so asking teams to vaccinate everybody is not possible. But they commented that as soon as that is possible, then they recommend that athletes should be, and team members should be vaccinated.
Okay. The second part of Simon's question, do you believe our athletes should avoid training in groups and pairs to maintain physical distancing and reduce the risk of catching virus at the games?
Yeah, my response to that would be as much as possible. And that's one of the tenets of protection and prevention in terms of catching the disease. This is a contagious virus that is spread by droplets. Just by talking, you can get it. So as much as possible, if you can avoid groups, if you don't have to train, for example, like a relay team or any other team-related events related to the Olympics, then you try and avoid it as much as possible.
Interesting. Thanks for that. A follow-up one before I go to Dr. Jones. Paul Reed had then put in to ask that as a follow-up to Simon's first question, some sport like gymnastics have already qualified and can start taking vaccine from now and get both doses in time for start of the games. However, in case of track and field, where the team will not be known until after championships in June, do you think there'll be enough time for the team members to get both doses before leaving for Tokyo? I don't know if that's something that you can shed any light on.
Well, that just depends on the type of vaccine that you're taking, and because there are different types of vaccine. And even though we have the AstraZeneca vaccine here, that needs 2 doses for full vaccination. But the problem with that is the time period between the first and the second dose, which currently now exists, is 10 weeks. And it depends on the time you get the first dose. Then the second dose may or may not come before it's time for the Olympic Games. So again, it depends on the type of vaccine that you're going to get, and the spacing, the interval, the time interval between the first and the second dose, and when our athletes are actually known in terms of when will be the Olympic trials. Correct. That will determine the team for the Olympics.
Very well. Thank you very much for that. Dr. Jones, if you don't mind, a question here again from Simon. What is your advice for athletes and the rest of the Jamaican delegation when they are in transit between flights to and from Tokyo to minimize risk of infection? Microphone, Dr. Jones.
Okay, again, it is a matter of trying to incorporate the principles that are necessary to reduce viral transmission. So I suggest everybody travels with a bottle of hand sanitizer or 70% alcohol on their person. Where possible, to sit, wear your mask during transit. If you have a pair of glasses, whether dark glass, whatever, any kind of glasses at all, to protect your eyes from droplets, wear them. Try to sit apart from each other in the plane. Sit as apart, as far apart as possible. avoid sharing stuff in the plane, like food items, containers and so forth, electronic equipment and so forth, phones, games, etc. Avoid doing all of that. Limit your conversation, because in speaking, that is one way of expelling the vaccine, and avoid speaking face to face. So it's things like that that they need to do while in transit. I think the airlines should sanitize their seats in between passengers, and likewise any other modes of transport that you take. Once you're in a certain location, don't move. If you have one chair, don't switch seats with somebody. Stay in that seat until you reach your destination, and other things like that to help to prevent the contraction and transmission of the virus during transit.
Since you're on the floor, Dr. Jones, I don't know if you know this one. There are two water-bodied sport questions here for you. The first one from Coach Alvaranga, who want to find out if the relevant about swimming, kind of just wanted to, based on the presentation so far, why then can't swimming be approved for competition? And not too sure if you have the answer. Can explain that one.
Well, I have expressed my strong views based on the evidence. Swimming should be allowed to compete, to go ahead and train and so forth, because there is no evidence that the virus is being transmitted in the water. The main thing is when you coming out, and that's why I say when you're out of the pool, sanitize your hands, wear your mask, and social distance. But once you're in the pool, there's no evidence that the virus is being transmitted in the pool. So swimming should be able to go ahead safely without increasing the risk, significantly increasing the risk of viral transmission. So why it hasn't happened, that is that is something that's on an administrative level or whatever. But based on the science, there's no reason why swimming shouldn't be able to go ahead. Likewise, racket sports, there's no reason why they shouldn't be able to go ahead, because they are sports that are socially distanced and their environment does not increase the risk of transmission. Cycling, likewise, etc. So it's the evidence is there, and why it isn't taking place is you'll have to check with the relevant authorities. I'm not exactly sure why it is, especially for swimming, because it's pretty safe based on the evidence that we have.
A quick one for you on surfing. Claudette Wilmot wanted to find out, are there any guidelines for surfing? I know time was on you, but I'm not too sure if there are any that we could send to the Surfing Association.
Yeah, well, it's the same thing. Like I said, I tried to outline the basic principles, of virus transmission, and then you can use that to apply to any sport. So for surfing, again, a socially distanced sport is outside, it's in a large body of water with no risk for transmission. So provided that you're not, so you don't need to wear a mask while you're out there by yourself in the water with the fishes and so forth. I think there's no indication that fishes and so forth transmit the virus. If you're sharing a surfboard, make sure you wipe it down in between. Make sure you wipe your hands, sanitize your hands in between if you're sharing equipment, and social distance. But there's no reason why you shouldn't be able to surf. It's outdoors, large body of water, high saline content, very low risk of virus transmission, no indication of the virus being transmitted while you're doing the event. The risk is when they come out of the water and they start to interact with people on the beach. So that's where they have social distance and so forth. So surfers should be able to safely go ahead without increasing their risk of contracting the virus, based on principles of what we know now.
Great. Thank you very much for those. Much more. Several questions coming in, tongue twister just now, but we're running out of time. I promise everyone that we'll be here for no more than 90 minutes. And so I just want to use this opportunity to say thanks to the presenters. We managed to get in question for at least one member of the panelists, at least one question. I really appreciate it. I see more questions that are in the respective chats. We'll try to get those answered and email. Remember that you can send any questions to us again on our respective social media platforms, and we'll try to get all those responses, those questions answered, and send back to you as quickly as possible. Now, this has been a fantastic journey over the past 90 minutes. So, ladies and gentlemen, allow me to thank our panelists, Dr. Lincoln Cox, Ms. Nadia Vassell, and Dr. Kevin Jones for being here today. And thanks for all the questions. Thanks for our participants for joining us. I'm forever grateful to the planning committee there, Tek Leroy and Rashika Grant, who is on production, and Sakima Gracia, our interns, who are doing a fantastic job, as well as Noblet Harris, who has been helping out with this. On behalf of our team here, Secretary General, Mr. Ryan Foster, President Christopher Samoda, both gentlemen have been on also. Thank you very much for joining. Remember to subscribe to our channel and follow us on our social media platform. Until our next webinar on April 22nd, I look forward to joining you again, or whoever is in this chair. Ladies and gentlemen, have a great day. Thank you very much.
Thank you. Thank you very much too.
Thank you.